Greetings. Today is September 29th, 2023. Excuse me. Welcome to the Regimen for URI Student Recruitment, featuring current and former URI students and faculty. My name is Jiwoo Lee, and I am a final year pharmacy student from the University of Rhode Island. Today, we're changing it up, and I'm interviewing two faculty members devoted to student-centered teaching across the required, elective, and experimental elements of the URI Pharmacy program. Here we have Dr. Todd Brothers and Dr. Jeffrey Bratberg. Welcome.
Morning.
Hey.
Great to be here.
Happy Friday. Okay, so to begin with, can you guys just introduce yourselves?
Sure. Hi. Good morning. So my name is Todd Brothers. I'm a clinical assistant professor here at the College of Pharmacy. I've been here going on my 6th year now. And honestly, probably the best career decision that I've ever made is to come to academia. So thank you for having me. I'm excited to have a conversation with everybody this morning.
Of course, thank you for being here.
Yeah, that's awesome. I mean, I was on the search committee, as I've been on many search committees, because I've been here. This is my 22nd year. I started when I was 12. And it is the only career decision I've made, and it's a great one, and I'm hanging out, and it's been awesome getting to know Dr. Brothers over almost all the years, and hiring him for the clinical site that I was at before, and now we collaborate on all kinds of wonderful positive curricular changes. So
great. Bouncing off of your comment when you just mentioned that you're very happy to be in academia, how did you get here at URI College of Pharmacy?
Great question. So in brief, I started off in the community setting, and then I really found my passion for just working with students, through everyday pharmacy technician kind of interaction. That being said, I transitioned into the acute care setting at a local hospital. Within there, a year or two, worked up to the ICU. And there I got asked to precept both IPPs and APPs. And I think that's really kind of from a student perspective where I hit my ground running of really enjoying the interaction with students. And then just by the way pharmacy works, you meet people and you develop, professional relationships. Dr. Pauchaukis was a good friend and colleague of mine now, was in my ear constantly saying, think about academia, and kept pushing it off. But I was honored to be able to come lecture in her course in the P2 fall. And then Dr. Barber and Dr. Hume in their PHP 560 advanced cardio class asked me to guest lecture a few times. And then I really said, I kind of like this. And then the rest is history. So.
And you should tell them what you specialize in too.
Oh, sure. So my specialty is adult critical care medicine. So both at the college and at my practice site, that's kind of my forte, if you will, is just taking care of patients with those types of diseases, as well as at the college helping out with the pharmacogenomics courses as well. Yeah.
What about you, Dr. Bratberg?
I always say I don't even know what I do. I was talking with some colleagues, and they're like, I was literally at the airport and ran into an alum and who still calls me Dr. Bratberg 15 years later. And he was saying, so you're still doing ID? And I'm like, well, I trained in infectious disease and I train in critical care. And then I now focus on sort of upstream problems, right? I focus on social determinants of health, people who use drugs, decriminalizing drugs and drug policy, anything that can help people, help the most vulnerable and marginalized people in society. And so I'm a public health practitioner. My practice site is now the Rhode Island State Department of Health. And so work with students to do things like this to make people aware of public health. The regimen kind of came out of what I do on my public health rotation. And then I have academic rotations, and Dr. Brothers and I work hard at saying, what do you need to know in practice, and let's make it as real as possible in the college. And I think that's the fact that we're able to just do that, and people support us, and the ideas are liked by other people, and it ultimately benefits students and benefits patients. This is why it's so great to be here, and why I'm enthusiastic every day to come work at the college.
Right. We actually have a really big fan base for Dr. Jeffrey Bratberg and Dr. Brothers here at URI College of Pharmacy. Just letting everyone know about that, because they're amazing professors to have at your college. So moving on to the next question, from your experience, what makes this university program unique or distinct from others?
Sure. That's actually a great question.
Because you're not an alum.
That's true. I am not an alum. So that being said, I think what speaks first and foremost to your point, Dr. Bratberg, is reputation. So I think it is clearly evident wherever our students go, whether it's at professional meetings, folks that we bump into from time to time, I have yet to hear a negative comment about students and their caliber of what comes out of URI, for lack of better words. So I think reputation for me, for the college, is somewhere where I would want to be, because I want to be a part of that type of circle of people to be able to do bigger things in my career and to help patients most importantly, and help students become better stewards and help more patients. So
Right.
It really is, from that perspective, I would say that's a unique feature, I think, of this college. The faculty, we could probably speak for about 2 days about their accomplishments. I don't know if students all the time really recognize the true dedication, passion, and talent that each individual brings to this college. So when you look at the totality of the work, when we sit in our, our staff meetings and our College of Pharmacy meetings, I sit there and I marvel at the folks that are here walking these hallways.
It's almost like we're too busy doing the good things to tell each other about the good things. Mm-hmm. And I sort of laughed. We had our department retreat, and there were people who were like, well, I hate talking about myself. And it's like, we literally gave you the opportunity to say what you do because we're so busy doing service and scholarship and teaching and student research that ends up being service or students testifying. We're applying for this community service award. And so just yesterday I was thinking like, oh my gosh, we should talk about the podcast and we should talk about our public health vending machine and like all these things that are just things that we're doing, but we need to do it. And I was just at this meeting and somebody came up to me and they said, oh, URI, he lives in Boston. He said, my daughter and I just visited down there and she fell in love with URI. And that's what I hear all the time too. It's not just pharmacy, but it's all the things. And I think the other testament is a lot of our colleagues, students go here, right? Mm-hmm. So it's always a benefit when the faculty are like, well, the school is so good, I want my kids to go here. Or, other professors do that. Or, people say, it's been I meet parents at graduation and they have only positive things to say, probably because there's no more bills. So that's always a good thing, right? But yeah, I concur. There's so much good going on that just drives us to keep and enhance the standards.
And just to add to that, if I can, just a little bit. So one question that we always ask recent graduates, and we put a lot of stock into this one question: if you had to do it all over again, knowing what you owe, knowing where you're at, knowing what you went through, would you do it? And I might be misquoting, but greater than 95, 98% say we would do this all over again. So not only do we think we're doing good things, I think that's where the proof is. Students would do it all over again.
Right. Well, for me, I would do it all over again, but I think I would do it a lot better. Just saying.
Yeah, that's fair.
Okay. So where do you see the profession of pharmacy heading in the next 5 to 10 years, would you say?
Where I think it's heading and what I hope may be two different things. Mm-hmm. So where I think it's heading, I think we're moving less into putting pills into bottles, and I think that is a skill that is great to go away. Anybody that really is involved in this profession or knows people in the profession knows how much more of what we really do. So I really would like to see that to go away. Provider status, I think, is the major thorn in the side that we can't get past just yet. Once we are able to obtain as a profession provider status, that will open up the floodgates to be able to touch more lives and improve patient care. So there's a lot of legislation and things I know currently around the country, maybe a little bit further ahead than Rhode Island, but I think for perspective 5 to 10 years, if that changes, I think the world is our oyster.
Yeah, I can't agree more. I go to these. I was at a grant conference, and people are saying, "Well, we're using our grant to hire people and do workforce and make sure that people who are vulnerable have access to services." So it's not just that we need to expand our capacity. And I said, there is a workforce that exists. They are trained to care for people. Mm-hmm. They're already in locations that are well known. And again, I focus on treating addiction, and the opioid crisis has killed 110,000 people in 2022. And, those numbers don't really mean anything, but each one affects a family, affects a community. And here we have these experts with life-saving medications like naloxone and buprenorphine. And, my focus of research is to say each one of those is a public health node. Because nobody says, where do I go get public health? What is public health? It's right there. We know this because we saved millions of lives and reduced thousands of hospitalizations through vaccination. Mm-hmm. And so this confluence of twin crises, the COVID-19 pandemic, which said, wow, they were there, they stood up, we paid them, they did it, and did it effectively. And there's this crisis of medication misuse or substance misuse, and we're right there in the community to help them. Provider status and public health and primary care and refills, and now we can do hormonal contraception prescribing and PrEP prescribing. All those things are coming together to say, this is happening in Rhode Island, it's happening nationwide. This is where the profession is going. The pills and bottles happens at that, where you don't have as many barriers. So I think pharmacy is going to reduce barriers, and we need to push that.
And I have yet to, just to add to this a little bit, I have yet to work with a clinician that doesn't think pharmacy is worth it. If you speak to anybody in the healthcare profession, they typically say, I love my pharmacist. Like, I don't want to prescribe, I don't want to administer without the filtering that information through a pharmacist. So as a profession, I think we have shown time and time again, you give us a challenge, we rise and exceed all expectations. So I really hope provider status eventually changes for us to do bigger and better work.
And I think building on that we've been focusing on both our close associations with the state association and with lawmakers now in passing these laws is advocacy. And we talk about this on here to say students testify, and the policymakers are listening. They're like, the college is coming, the faculty's coming, the leaders are coming. We're contacting those folks. And so I think that once pharmacy shifts to say everyone is an advocate and how important that is, all we have to do is make people more broadly aware of what we can do, and we'll have equality. And that's all we're asking for, too. So we're just asking for equality and reimbursement for the services we're doing, because it is cost effective. We're not paying us more for less. We're just saying, everyone, we all work with other disciplines. Let's keep doing that. All get paid the same, or some kind of payment mechanisms that again, we talked about pharmacoeconomics.
Right.
and again, the alum said as we were getting on the plane last night, he's like, if I knew what I was going to do when I graduated 15 years ago, I kind of wish I should have taken more pharmacoeconomics. So that's a little topical note.
And I challenge our listeners out there, if you don't believe kind of what you're hearing here, Google it, right?
Yeah.
Just Google, how does pharmacist improve clinical outcomes, most importantly, and also reduce healthcare expenditures. They don't have to be in opposition to each other. They can be parallel. So for the future business folks out there in the world, you could still make money in healthcare and provide better patient care. So it's not a dynamic that can't work in congruence with each other.
And two things I have to promote the university. We do have a PharmD MBA that a lot of folks do. Mm-hmm. I've taught a lot of those folks. And we do have a PharmD MS and health outcomes. And so there's, for people listening saying, should they go there? Gosh, this is the future. I want to be trained, or I want my relative to be trained in these things. We offer those things here.
Right. I think because of these growing impact in pharmacy and of pharmacists, it is very important for people to actually be in a really competitive and supportive pharmacy program. And that's what we offer here at the University of Rhode Island College of Pharmacy. And that's why it's very special. And that's how it really differentiates us from other colleges, I would say. So moving on, what would you say are the 3 areas that remain most challenging for student enrollment and engagement in healthcare professions, and particularly pharmacy?
Sure. So I think we have a identity crisis within our pharmacy profession. What I mean by that is folks know 1 or maybe 2 avenues of what pharmacists can do. So I think as a organization, as a college, on a larger level nationally, ASHP, ACCP, I know everybody's trying to really get the word out to say we do so much more than I think what the community really understands. I would actually push a little bit further and say, besides pills in the bottle, besides putting a flu shot in your arm, there's a whole different world of how a pharmacist is involved in a patient's care, and they may not even know about it. For example, when I work in the ICU. So part of our job in pharmacy is to help the team make better medication decisions for the patient. What does that mean? The right therapy, a safer therapy, etc. So if I could help make the team smarter, if you will, provide better patient care for better outcomes, that patient in the bed may not even know who I am, not even know what my role is. And let's be honest, all the family really cares about is let's get my loved one better. So truthfully, it's an honor and it's a passion of mine of why I still do this. And what allowed me to do that is my PharmD. So I think the identity crisis within the community of not knowing what a pharmacist does, we need to figure out how to change that trajectory. That's one major challenge.
Yeah, identity crisis, I completely agree. And it's hard because a lot of pharmacists like being behind the scenes, right, or behind the counter, instead of in your community, in those long-term care facilities, giving vaccines, advocating for these things. It's hard. I think that folks are like, yes, I want to be the science and math person, and I want to be behind the scenes or be in front of a computer or be in the traditional hospital basement. Nobody walks into a hospital and says, oh, that's where all the hospital pharmacy people are, right? It's not, there's the gift shop.
Right, or the cafeteria.
There's the cafeteria. Mm-hmm. And so the visibility is a hard thing from a structural standpoint. But again, if people realize they can be advocates and you see so-and-so PharmD wrote a letter to the editor to say, hey, this is what it is. And I think that's the thing. I think it's the local grassroots. You mentioned these national organizations. That's great. We can get notes from them. But go into your individual community. Every single lawmaker goes to a pharmacy, and you can influence it there. You just have to have that one contact. I've talked to these folks sometimes. I was testifying in Massachusetts. They're like, I love my pharmacist. Despite this identity crisis where you walk in, and as a parent, my kids are in middle school, to go, do I want you to be doing that job? That person doesn't look happy, right? We've got a crisis. It's recognized. I think that in the, people who come to this college in 1 or 2 years and graduate in 6 years will find a different profession on the other side.
Right. So speaking of challenges, how would you say the College of Pharmacy here at URI really prepares the students for these challenges moving on into the future and also other academic throughout their academic journey?
No, that's a great question and probably multifaceted. I'll try to take the angle of what we do well here. Our graduation rates are extremely high. The first time passing of what they call the NAPLEX exam, which is the official pharmacy board exam, which is a national exam that you need to take to become a licensed pharmacist, extremely high rates of passing the first time comparatively to, New England and nationally. So that being said, I think the proof is in the pudding there. We do a great job academically preparing the students. How do we prepare them professionally, right? Emotionally, all that stuff. We have multiple student professional organization groups that students are actively engaged and involved in with high enrollment in those early in the program. So there's leadership skills that they learn along the way. There's ways of doing service-related activities that I know Dr. Estes in the group expansion, is always kind of our goal here to reach more students and more patients. So totality-wise, I think the mechanisms we have in place equals high successful graduates. And then I don't know, Dr. Brackberg, if you want to speak to postgraduate training and fellowship.
Yeah, I mean, we consistently, Dr. Ward, our colleague, has innovated and for many, many years, probably over a decade, has said, here's how you get your residency. So it's great that we're training them for the logistics of that, but they're clearly trained in the programs in competitive postgraduate fellowships and residencies consistently match our students. So clearly they're prepared. The people who want to do it seek those mechanisms to ease the logistics and write a great letter of intent. I just got a request to write a letter for somebody, and I said, your email already tells me all the things that I completely agree with. And so I think the other thing that we role model is something you said, G, is support. And I think that comes in those surveys that students take is, did you feel support? Like, do you know your professors? This is your idea to interview us. I was like, we should interview students and have them talk about why they came to URI. Todd just came to URI. I've been here forever, it feels like, which is good. And still innovating is that we say, what is practice look like? Let's make sure that you're ready 6 years out, 10 years out, have those skills, but ultimately have the patient and the community at the center at the same time. And that's really hard to do when it's sort of, I need to learn these facts about this drug, to say, how do you compare the drugs? You help write an assignment to say, students tell each other how you study. That's student-centered care, right? It's those other aspects. I think you alluded to, the emotional support and things like that.
Yeah.
I think as a student, something really important is that you can really feel that the school is preparing you to become a really good clinical pharmacist not over like just passing the NAPLEX, over just like getting through college. They really want to prepare you to be a really professional human being and a professional pharmacist. That's the goal of the school itself, and you can feel that as a student, and that's why it's really important. And that's why this program is very different from others, I would say. Okay, so how would you say the faculty at the URI College of Pharmacy? Oh, we actually went through that, so we're going to move on.
No worries.
What are the qualities you look for in students as a professor in the College of Pharmacy?
Ooh, it's probably all the way you were raised, right? From a little human, right? From birth. One really large quality, I guess, lack of better words. One quality that I think is essential, there's a better way of saying it, is integrity. Anytime you take care of people, anytime you're involved in research, anytime you're involved in any relationship with any individual to whatever capacity, integrity is key. Why do I say that? Because the world in which we live, I think we're having struggles out there. The profession of pharmacy requires high integrity for the individual. Do we make mistakes in healthcare? Absolutely we do. I think the best thing we can do is obviously be as trained as possible to avoid those type of errors. But if they do occur, you have to have integrity to admit that you made the mistake and learn from it. And hopefully it's not at your patient's expense. So for me, integrity is one big word. Self-driven ambition and motivation. Nothing is worse than an incurious student. When I asked,
you stole mine.
Did I steal that from you? I'm so
okay.
sorry. But I probably adopted that from you, right? So to that end, nothing's worse when you have a trainee that is really not actively engaged. So I can't make you be passionate. I only could show you what I do and kind of how I do it. And hopefully that inspires you. But, through situations just like this with your podcast, I hope students out there are listening saying, that's what I want from my career. I want to be happy at 40-something years old and be in a career path that I feel like I'm helping people. You get paid a really good wage to be able to support yourself and your families, and you wake up every morning happy and passionate for what you do.
And I would say take that integrity and curiosity and realize that you're part of a bigger thing, right? I mean, it's okay. Pharmacists are well paid. I know nobody here disbelieves that. That's totally true. But with that, higher education privilege and professionalism and licensure and integrity, all those things build into, giving back, right? Whether it's one student, whether it's being a preceptor, where Dr. Brothers, essentially started, whether it's that one lecture, or whether it's that one naloxone training event, or whether it's that helping out with interviews. We heard at our retreat this fall that alums are desperate to come back to help. and work in our lab settings and help with interviews and help with all those things. That's also a huge positive. You like the education, you do it again, and they're willing, if they're able to contribute in those ways. And so I think that's again, not just helping the college, but your community, being a coach, right? I think you do all those things, right? Yep, so you live your values and your mission, and I think that's we all. How many of us helped out at COVID-19? I don't want to focus too much on that, but we've got a vaccine podcast to record after this. But if you look at our annual report, of course, both of us are in it. Actually, all three of us are in it, right?
Oh, right.
Oh, you're in it too? Wow.
Oh, no.
I know. We're superstars. Yeah, I forgot that she was in it too. So,
but it's funny you say that, because opportunities in this career come along that you cannot anticipate, G, in your shoes right now.
Right.
And then you get skills as you go through your profession. And then you realize quickly, wow, I do have a skill set that can really help people on a broader level, a statewide level. So then you get tapped on the shoulder to be able to assist. And it really, selfishly for me, it was so rewarding and also stressful. But the rewarding piece is, this is the skill set that you cultivate over years after post-graduation work. And what an honor it is to really take care of patients in the most vulnerable time when they need you most. So there's these opportunities that the profession will offer to you if you're thinking about going into this profession are endless.
And I think it should be said too, in your case, but I think our colleagues' case, it's not meant to show off. It's not meant to check a box, right? I think a lot of folks who are college bound or are competitive, professional programs are like, I need to do service learning and I need to do volunteering, or I need to start a company. And it's like, just slow your roll. do the things that are you, and you'll be fine. Or when I meet my advisees, so the other thing that all of us have advised or have students, and your class I saw as P1s in our new curriculum, and they sit down. I say, I want your CV in 3 years to look like this. Have a consistent message. You're interested in oncology. You're interested in managed care. You're interested in specialty. You're interested in critical care. Show how you demonstrate that. Do some leadership. And I think that's the other thing, too, is there's infinite possibilities for people to do that. So all those CVs translate to residencies, which translate to alums who then, give back to the college and their community.
Yeah, the educator in me says if you're thinking about it out there and listening in, it's a staircase. So you start at the bottom stair when you come in, you get skills, and each part through your career, it's a staircase. And your success is defined by you. It's not defined by myself or you. You have to define you have to find your own success.
Yeah, no FOMO.
Right.
What's FOMO?
Right.
I don't know what's FOMO.
Fear of missing out.
There we go.
Fear of missing out.
So now we can
gosh.
hashtag that, and everyone will find this podcast. There you go. All right.
Okay, let's go viral. Okay, so that is it for today. Thank you so much, Dr. Brothers and Dr. Bratberg, for being in this conversation today. And I hope the listeners here found this conversation informative and entertaining. If you enjoyed today's episode, please take a moment to subscribe, rate, and review us on your favorite podcast platform. Your feedback helps us reach more listeners and continue to produce great content. Thank you for listening, and we can't wait to have you back with us on the next episode of The Regimen.